When we approached Herb and Suzanne Tyner, as well as their entire family, regarding this concept we had, building a hybrid operating room, which is a combination of an operating room and a catheterization laboratory, so that surgeons and cardiologists can work together in the treatment of heart disease. They were very excited with this opportunity.
Historically, cardiologists performing invasive procedures have worked in a catheterization lab using X-ray imaging equipment. On the other hand, cardiac surgeons performing conventional open heart surgeries, such as bypass and valve replacements, have worked in a traditional operating room suite. The Tyner Center incorporates the best of those worlds and allows the cardiac surgeons and the cardiologists to work side by side in a unique environment.
We can do what we call a hybrid approach, meaning that we can do a minimally invasive valve operation, and then in the same room we'll have the opportunity to stent a coronary artery if it's blocked, or to do a procedure to block a hole in the heart. What this allows us is to treat complex problems in a very minimal and less invasive way. We find now that if we can offer less invasive approaches to these patients, they not only do better in terms of their outcomes, but we can treat more patients because we don't have to worry about the complications that can be associated with more complex procedures.
One of the unique attributes of the Tyner Center is the size of the room. We looked at many other hybrid operating rooms around the country, and we learned very quickly that we needed a large space to really make this most efficient and functional because of the large number of physicians and team involved in these complex procedures. So we created a room which is about 1,500 to 1,600 square feet in size, which really provides adequate room to encompass everybody in the room. One of the unique design features of the Tyner Center is an observation room adjacent to the hybrid operating suite.
Mr. Tyner wanted to make certain that we did one thing, and that was that we provided the ability for teaching. He wanted students and other physicians to have the opportunity to learn if he was going to build this new operating room.
This allows physicians, staff, residents, and fellows in training to watch procedures in real time as they're being performed, which is really unlike any other facility in the country or around the world. Additionally, we will be able to broadcast cases being performed in the Tyner Center, not only to other places throughout the hospital, but to other centers throughout the country, to teach those physicians about many of the innovative procedures that are being performed in the Tyner facility.
These are the newest, most innovative procedures being done, and this operating room will give us the opportunity to be a leader in this area.
The Tyner Center is truly unique in hybrid operating room labs, not only throughout the country, but throughout the world. And we're greatly indebted to the Tyner family for their gift to this institution.